pessoal, eu estou aqui com o professor Franz Porzsolt, alemão, criador de várias ideias originais para o pensamento médico baseado em evidências. Nós estamos na Universidade Federal Fluminense de Niterói, no simpósio de pensamento médico baseado em evidências, organizado por Tânia. Estou aqui para falar de uma ideia que Franz desenvolveu, que é a ideia de economia clínica, clinical economics. Normalmente, a gente, quando pensa em economia, a gente pensa do ponto de vista monetário, mas a economia é algo que vai muito além disso. E ele vai explicar a vocês que a economia clínica, da forma como ele cria um conceito, é um pensamento baseado em valor e não apenas uma questão de custo-efetividade, como muitos pensam. So, Franz, your concept of clinical economics regarding value is very interesting. I think it's very important for the clinician. So, explain to us what is this clinical economics thing, maybe what's the economy itself.
Yeah. Actually, it goes back to my previous profession when I was working as a medical doctor and a medical oncologist. I was sometimes very much concerned whether the side effects and the burden of our oncology treatment were really balancing the values the patients get back. So I was thinking about the necessary analysis which compares what you have to give away and what you get back. And by doing these considerations, I stepped into an economic analysis, which is nothing else than comparing costs. It's not monetary costs, it is everything you have to give up. And on the other side, consequences. This is everything what you get back. And the important thing of a complete economic analysis is that you compare costs and consequences of alternative ways of actions. And this is exactly what we should do in medicine. And this is exactly what I try to teach my students, that they think of costs and consequences of several possible ways of actions.
Right, so for example, for a patient, I just wrote in the blog when we analyzed the STITCH trial that the patient is candidate for cardiac surgery, high-risk cardiac surgery, because the patients had severe heart failure. So that's a cost, the stress, physical stress, pain, and maybe risk to even die in the moments close to surgery. And what do the patient get back?
Yeah.
In that case, the patient would get back several years after the surgery. So you invest here a lot of pain to get some survival benefit 10 years from now. So it must be thought in this economical way, you think?
You know, we can learn a lot from economists. They call it discounting. When you have to give away, you have to pay today, but you will get back the value only 10 years later. So you have to discount the value for a period of 10 years, which is a difference as compared to getting back the value immediately. It's much more worth.
So how about you as an oncologist? Can you give an example of this trade-off of economics?
I mean, this trade-off is important in any oncology treatment, because most of these treatments have side effects and have risks. And you have to discuss these risks with your patient. And you have to tell them the truth, and you have to know how big is the chance that we will achieve the expected benefit. Do you see how difficult it is? And how this connects to the other topic we discussed before, whether the result of a clinical trial are really true. So how can you communicate with a patient the results of a clinical trial unless you can read and detect the potential errors in such a trial? You see, everything connects to everything.
Yes, and patients may value things in different ways, right? So you give the example of a broken finger of a pianist. Can you develop on this?
Yeah, you know, I'm using this example of a broken finger when it's a piano player. This is a horrible situation, and he will spend a lot of money to get it completely repaired. When you have a lawyer with a broken finger, this is not the catastrophe. So, you know, he should be able to sign some papers, but that's about it.
So the piano player might assume a much higher cost treatment because it's what he's getting back is worthwhile. For example, if the treatment brings a lot of pain, several surgeries, he will do this. But maybe the lawyer will say, well, it's not worthwhile for me. I'll stay with the finger the way it is.
That's exactly.
So that's why we have to be guided by scientific evidence in terms of knowing what the treatment offers us, but the final decision should be shared with the patient, right?
Yeah, the patient expects that we help them to make these decisions. We give them, they expect to have the liberty to make these decisions, but they need some support and they need information to come to a final decision.
Então, pessoal, observe que o conceito de economia tem que estar muito presente na mente médica. Lembre-se que o conceito de economia não é apenas monetário. Quando a gente pensa em custo-efetividade, custo é muito mais do que dinheiro. Às vezes o paciente não está preocupado com a questão financeira, o convênio vai pagar, ou o sistema público vai pagar, mas ele tem sempre um custo. Nem que seja tomar um remédio, ele vai estar... Even drugs or medicine, there's a cost. For example, statin therapy, people say, I don't want to take statin therapy because I might have pain in my muscles and I like to run. So there might be a cost or a risk there. And some people want to have this. It's not such a big deal, in my opinion, this muscle thing. But some people really don't want because they are runners, they don't want to risk this, and other people, it's okay, it's not a major problem. So even drugs, you have a cost to be taken. There are some people who would like to avoid drugs, like people more natural. So for them, it's a cost to take the medicine.
Of course, and this is extremely difficult to communicate risks for the doctors. Imagine, think of a drug information leaflet within the package, you know, of a drug when you go to the pharmacy. There are all kinds of warnings. When you inform the patient according to this leaflet, almost no patient will be able to take the drug. So you see the responsibility of the physician. You cannot provide any information which is available. You have to have developed a very fine feeling. What is the essential information you have to provide for ethical reasons, and what is the information which induces more harm to the patient than benefit?
Ok, thank you very much. Então esse conceito de economia clínica ele tem que estar, do ponto de vista de medicina baseada em evidências, naquele último momento que é o momento da aplicabilidade da evidência. Lembre-se que quando nós temos o pensamento médico está baseado em evidência, deve começar pela análise de confiabilidade interna. A gente analisa o impacto de um tratamento e seus riscos e, por fim, a aplicabilidade. No momento da aplicabilidade entra esse conceito de economia clínica. Portanto, pensem sempre em economia como algo que tem que estar no pensamento do médico e que isso vai além de uma questão monetária. Thank you very much, Franz.
You're welcome.